Welcome to the Neuromodulation podcast, presented to you by the International Neuromodulation Society. Dive into the forefront of today's emerging neuromodulation techniques, insights, and ethical and clinical applications. Subscribe now to join the multidisciplinary collaboration of medical care providers, scientists, and engineers who are part of the global conversation that's shaping the future of healthcare.
On today's minisode, we welcome Dr. Shruti Agashe on behalf of the journal Neuromodulation, Technology at the Neural Interface, to interview Dr. Lisa Goudman. Dr. Agashe is a practicing epileptologist, biomedical engineer, and assistant professor at Duke University. I'll allow her to introduce Dr. Goudman, and for your awareness, the video version of this interview is available on both Spotify and YouTube. Let's dive in. This is Dr. Shruti Agashe, and it is my utmost pleasure to introduce Dr. Lisa Goudman. Dr. Goudman is an assistant professor at Vrije University in Brussels, Belgium. She has received a fellowship from the Research Foundation Flanders to conduct research in the field of neuromodulation and chronic pain. Currently, she is mainly focusing on multi-component endpoints and ways to measure pain more objectively. Dr. Goudman is the section editor for Biostatistics for the journal Neuromodulation. Welcome, Dr. Goudman.
Thank you very much.
It's our pleasure to have you here. This is meant to provide some advice and also maybe motivate folks who are planning to submit to the journal. We would love to get your thoughts on a few things and chat about a few other things as we go along. My first question for you is, do you have any advice from a biostatistical standpoint for researchers who are preparing their articles for submission to the journal?
I think there are two main points that I would like to stress out. And the first one is really about clearly defining the number of patients that took part in your study. For example, if you have a longitudinal study, then probably you will start with 50 or 60 participants. And then after 1 month, you end up with 10 people less in your study. And then gradually more and more people will drop out of your study. And sometimes it's a little bit confusing. Like for the authors, they conducted the study. So they definitely know, like, we had 60 patients to start. At 1 month, we had 56 patients, for example, and they will know the numbers. But very often it's a little bit vague in the manuscript or not that clear for external people to see how many patients are there definitely in a study. So one advice is to clearly define the number of patients that are in your study, the number of patients that were lost to follow up or that definitely dropped out of the study, because the field is evolving and we are more and more doing meta-analysis. So combining the data of every publication or every article that has been published in neuromodulation. And then if the numbers are unclear, you cannot always use all the information that is in the articles for your meta-analysis. And if the field wants to progress and move forward and combine or merge all the data to grow, then I think it's crucial that we have clear estimates and also clear numbers on how many patients were included in each analysis. For example, also if you do a safety analysis, or you determine the efficacy or the effectiveness of an approach, then probably the numbers will be different. If you just clearly state the number of people that are included in the study at each time point and also in each analysis, then I think the field will definitely benefit from that. And another thing is, don't use statistics for fishing expeditions, because we always have a certain hypothesis in mind and we want to prove it. We are researchers, so we always want to prove the statements that are in our heads. And sometimes if the first statistical test is not able to show you the results that you were expecting, then probably you will say, I did something wrong. I will do another test. And then another one. And you keep on going. And finally you find something. And that's what we call a fishing expedition. And it's very attractive to do it because we want to prove what is in our mind, what we believe in. I think that's something that we should be cautious with, because you will end up with a research question that is not related anymore to the statistical test that you are conducting. And then the manuscript will be a little bit about the first question, then a little bit different because you did a test that is not in line with your research question. So I think that's another point, that it's not a shame to publish a negative study. It's something that needs to be stated as well, because others can learn from it, whether it's negative or positive. It's always useful. So that's my second advice.
Oh, very good pieces of advice, both. I think personally, I've seen these very long-term studies going out 9, 10 years, and where you start off with the numbers versus at the ninth year, you're at maybe 20% of the initial
Yeah.
population that you were studying. So absolutely. And I think all of us have been in that cycle of, oh, this statistical test is not working. What about this other one? All of us have been in that. And I think both are extremely valuable points for our authors who are going to try to publish research from their labs very soon. My second question for you is, given the age that we're in, folks want to know, are you using any AI methodologies? Are you seeing any being a part of neuromodulation research? What do you think about those? What's your opinion on those?
Yeah, to be very honest with you, I was a little bit skeptic at first about everything, or all the fuss about AI tools, AI methodologies, and everything related to it, because I was afraid intrinsically. I thought AI cannot take over what a human being can do or can think about. They are not yet that developed or sophisticated. So I was a little bit skeptic, and I think I was a little bit late compared to all the others in the field. But there is something that I would like to stress out. And when I think about AI methodologies, then I think about the tools to do artificial intelligence. But on the other hand, statistics are also a way of doing artificial intelligence, because every statistical test can be placed under artificial intelligence. It's a specific part of AI. So basically, every one of us is dealing with AI for already decades, probably, but we just didn't realize it, or now we have a different definition of what is AI. And we don't say that AI is machine learning, but machine learning is incorporated in artificial intelligence. So I think a lot of us have to say, or probably everyone, yeah, we do use AI, but if we specifically focus on the AI tools or the methodologies, then I'm not using it that much. And it was only yesterday that I thought, maybe I should try that just to have an answer on that question. And then I tried it out with that question. In the field of neuromodulation, are we using AI methodologies? The answer, I used ChatGPT, was yeah, of course, it's everywhere in the field, more specifically. And then the answers were like natural language programming or clustering, personalized pain treatment. So basically, everyone in our field is using it, but
Right.
it's mostly related to the statistical test. If we are clustering patients and personalizing treatment for a specific patient, then it's always relying on the statistical tests. But I do think that we can use AI tools to generate new research hypotheses or as writing assistant tools. I think the field will evolve, and that we will see AI more as some kind of a peer to us, that he or she, the tool, can help us. And that's where I think that we will evolve towards. But yeah, I'm always a little bit afraid of using it. I think there should be clear policies. And the main problem is when you don't have the references. And if you are writing an introduction or a discussion for an article that you want to publish in neuromodulation, then you need to have a reference after every sentence or every two sentences. I think that's where the field still needs to evolve. We can definitely use AI tools by including the references as well.
Very important. And it's a very different way of thinking because, yes, we have been using AI for everything technically. And I think the thing, as you said rightly about AI, is what went behind creating that tool. What's the reference? Understanding the methodology a little bit better before using any tool is extremely important. So I completely agree with that. The other question we had is, and you alluded to a few things earlier when we first started discussing, is the reproducibility and reliability of research findings. How does a researcher ensure that? And do you have any pieces of advice for folks that are trying to make sure their research is strong, is something that can be reproduced?
Yeah, I think everyone definitely wants to create a robust evidence, if I may call it like that, and that everyone can replicate it, that it's not a result that one group published and the other people are incapable of redoing the same experiment. I think that transparency is key. And transparency should be included in the method section. When I have an article that I want to read, I always start with the method section because there you know all the details. And it sounds a little bit silly, like we don't have really the time to invest in clearly describing the population, for example, that we aim to sample. But it's in those aspects, like the population, the outcome measures that you use, the statistical tests, that everyone else is really capable of interpreting and definitely knowing in depth what the artist did. And it's often time consuming to write everything out. And what a lot of us might be tempting to do is just like summarize everything. And we write 2 or 3 sentences about the population. The statistical tests, we will write, for example, 2 sentences and then it will be okay. Like for the outcome measures, we can say we measured pain intensity with a visual analog scale. But we all know that a visual analog scale, you have different modes. You can do it with a verbal mode or written. Was the physician influencing the patient? Was the physician who was completing the pain intensity score? Was it the patient? And it's in the details that there are often problems that you cannot replicate specific results. And that's often just not stated in the method section. And I think that those elements are really crucial, especially, for example, with the reliability and the pain intensity scores. We are sometimes surprised because in clinical practice, if we ask a pain intensity score, then people are not capable of providing a score ranging from 0 to 10 or to 100. And if they have to do it on a written scale, then sometimes they just write a number instead of a cross, or they write 3 numbers on it, and then you are incapable of interpreting it. And those are the data that we are confronted with. Sometimes also in clinical research, and you have to translate it into one score because I don't think there are publications where you can see 3 scores on one scale or something like that. Those are the details that you definitely need to think them through. Maybe you can do it like with an electronic version of the pain intensity score, just to have already less bias and that patients need to fill in one cross or one number and that you're just incapable of providing 3 numbers, for example, because that's what they can do on a paper format. But then you need to state it in the method section. Was it a paper format, an electronic format? And those details, they are often not included. But I think they are crucial to make an own interpretation about how robust and how reliable is the data that a specific group is publishing about. It's also time consuming, but maybe a risk of bias analysis, you can do it on your own article. If you have written the complete draft, then just try to score your own article. And if you can say a checkbox or check on every item, then this article is fine. You described everything, all the risks related to it, all the outcome measures. I think if we all implement this in the daily routine when we are trying to publish, then I think that the field can move forward as well. So I think it's all in the transparency and more specifically in the method section.
No, that's a great point. I love that part because really that's where all the details should be in case anyone wants to reproduce what you've found. And also, that's where we ensure that the results are reliable as well. That method section is key.
Yeah.
Dr. Goudman, I really enjoyed talking to you today, and I'm sure the audience who's listening in today will get a lot of good tips and pointers. I want to thank you on behalf of the journal, and thank you for spending the time talking to us today. And hopefully we get a lot of very good quality research being submitted to the journal very soon. So thank you so much for your time.
Thank you for everything. And I'm also looking forward to all the publications or the manuscripts that will be submitted.